Diabetic foot ulcers are one of the classic lesions of diabetic lower extremities. Going back 2 centuries, there are descriptions of diabetic foot ulcers. And again, a diabetic foot ulcer is generally or usually a painless, deep sore in the foot that develops as a result of minor injuries or cuts or scratches. But studies have shown that one predisposing risk factor that can lead to ulceration is something as simple as a callus, a thickened callus on the sole of the foot, which becomes very hard and becomes like a pebble or a rock under the foot. And imagine if you have neuropathy and no feeling. You continue to walk on that hard part on the bottom of the foot, and this leads to high pressures. And a high pressure in any one part of the foot is going to lead to injury on that foot. So we know that calluses in and of themselves can be an important risk factor for subsequent ulceration and infection. Just like a crack in the skin due to excessive dryness can lead to bleeding, which can lead to ulceration, especially in the presence of peripheral arterial disease. Ingrown toenails. Ingrown toenails or thickened toenails that can result in excessive pressure on top of the toe itself have been shown to lead to ulcerations even under the nail itself in a patient who might have neuropathy. So the importance is that these simple, common lesions, if you will, that might be present in a patient without diabetes become very serious, important risk factors that can lead to ulceration, especially in patients with neuropathy or patients with peripheral arterial disease or both. And when a patient has both of these complications, even the simplest of lesions on the foot can lead to very serious consequences. Hence the need to have these problems taken care of regularly by healthcare providers so that they don't get out of hand and so they will not lead to progressive problems that can become limb-threatening in themselves.